get on my way up. It's all up, coming from the nation, all foundation, true stuff, yeah, too tough. We ain't giving up on our dreams, everything is ahead of us. Stay true to your path, that's not where you start. It's all where you at, it's where you end up. When your back's to the mat, you cripple the flat or get up off your back. Deliver these facts, see them react, the stadium tact. They all them snacks, the motivated attract. Yeah, you let it attack, frustrated hit back. Yeah, you little facts, frustrated hit back. Yeah, we move fast. I wanna change everything, I wanna change everything. I swear I'll do anything, I swear I'll do anything, just to get where I wanna be. Just won't stop till I'm free, I won't stop till I'm free, I won't stop. I won't stop, no, I won't stop, no, I won't drop, no, it won't drop, no, it won't stop, no, I won't stop, no, I won't drop, no, and don't drop, no. It's automatic, always getting after it. If you ain't working out, then understand what's happening. There's not enough time just to be imagining. You gotta take some action towards practicing. I know it's not easy, but you gotta get out there. You don't mean you can't afford to opt out there. Interrupt him and I just wanna look out there. The crowd all screaming, look out there, the crowd all screaming. I wanna change everything, I wanna change everything. I swear I'll do anything, just to be where I want, just to be won't stop till I'm free, stop, stop till I'm free, stop. I won't stop, no, I'll stop, no, I won't drop, no, and drop, no, I won't stop, no, I'll stop, no, I won't drop, no, and drop, let go, I'll stop, no, I won't drop, no, and drop, no, I won't stop, no, I'll stop, no, I won't drop, no, and drop, let go, let go.
Welcome to my channel, Level Headed with Levi D. Today we'll be covering the new 988 hotline, the mental health hotline. That is a federal law that goes in effect July 16th, 2022. I did a little research on this. There's a lot of facts and a lot of scrambling by some states to get this to go into effect. And this is something important to many people, as now a lot of people call 911. So having this number will help as well. And I'm just going to take this down here real quick. So 988 mental health hotline. What it is, what it means for you. So what's happening? The National Suicide Prevention Lifeline is getting a new number in July. All you have to do is dial 988 for a crisis intervention. Why it matters. Suicide is the second leading cause of death among young people. What it means for you. 988 is an easy to remember number that you can dial to connect with suicide prevention and mental health crisis resources. A new 3-digit mental health suicide and crisis lifeline will launch on July 16th. 988 will bring mental health resources to Americans by replacing the 10-digit number of the National Suicide Prevention Lifeline established in 2005. The 10-digit number will still be active. The 988 is just a much-needed update that facilitates getting help during a mental health crisis. Health officials expect the simple number change to significantly increase call volume to local crisis centers, meaning what is intended to be a stride in accessibility may unintentionally overload already underfunded crisis centers. The RAND Corporation surveyed 180 health officials to gauge preparedness for the 988 July rollout. Findings include only 16% of officials reported adjusting budgets to include 988 operations. 85% reported mental health centers operating in their area. However, less than half are part of the Lifeline network. 48% of the centers only have short-term crisis stabilization services. Only 28% of the centers have urgent care units ready for dispatch for mental health events. The report shows that the upcoming number change has not translated to increased resources for crisis centers. So what is 988 and does it work? 988, when you dial 988 come July, you will be connected to the National Suicide Prevention Lifeline, a network of 200 nationwide crisis centers. It is an equivalent to 911, will connect you to trained mental health professionals who can help. 988 will not have all the resources 911 has. The network will be closely communicating with 911 dispatchers if emergency resources are needed. According to the Substance Abuse and Mental Health Service Administration, only 2% of the current Lifeline calls require emergency support from 911. What happens when you call Lifeline? When you call, you will be directed to your closest crisis center based on your area code. Once connected, the trained mental health professional will listen and help address the issue by providing support and resources. You will be connected to a backup location if your local center is unavailable. The number change for this resource might not seem like that big of a deal, but removing the barrier of being able to find the 10-digit number online or remembering it will make it more accessible to people. Lifeline and other hotline work. Studies show that hotlines are effective in helping people who are experiencing thoughts of suicide or having a mental health crisis. 66% of people said that the chat intervention feature offered by the National Suicide Prevention Lifeline is helpful. So what's the issue with the 988 number? In terms of function and goal of 988, there is no issue. However, money and resources are lacking to support this initiative. Congress authorized 988 in 2020. However, the funding for crucial things like staffing and infrastructure, phone line, internet connections were left to the states. Most states haven't yet set aside money for it. Only 13 states have legislation that addresses funding for a 988. Many states haven't made progress on legislation in the face of the federal mandate. President Joe Biden's 2022 budget request includes funding for Lifeline. However, according to the SAM HSA report, federal and state resources are needed to support the estimated $560 million needed to help local centers prepare and $110 million annually to fund the 988 hotlines. Our mental health system is already underfunded and under-resourced. The concern is that local centers will be unable to keep up with the demand for the calls. Being routed to another crisis center unfamiliar with local resources is problematic for quick assistance. Calling 911 is not an adequate stand-in for mental health emergencies, as you may not connect to someone qualified to address the situation properly. When it comes to mental health events, minutes matter. The 988, what's next for 988? So the 988 hotline will launch on July 16th, regardless of whether centers are ready to take on the influx of calls, even with the potential road bumps. 988 is a good thing and an undeniable step toward addressing the growing mental health crisis in the USA. We should expect a time of growth and adoption adaptation, sorry about that word, in the coming months. Considerable time and resources from state and local organizations are needed to help centers prepare to strain widespread accessibility. Brings hopefully 988 is only the beginning. The information in the article is for educational and informational purposes only and is not intended as health or medical advice. Always consult a physician or other qualified health provider regarding questions you may have about a medical condition or health objectives. So I have linked this to in my description of this video. I've linked this and all the other links of the information in my description so that it's easily to be found for people that need it. And I am glad that I ran across this. And I want to give a shout out to Superior Dream 19. You put this in my Discord. I had no clue what it was. You put a little, not this article, but you put a little 988 July 16th, 2022. I looked into it, and this is what I found. I also was listening to interviews yesterday on Ellie Reagan's case, and they did say about the rollout of this that I did hear it mentioned, and I've heard it mentioned in a couple other places. Hopefully this one here will load up. So each state by state is in charge of their own funding right now. What I want to do is this is South Carolina. This is Greenville. Just an example of what is going on and how they're preparing. And I will get this to load here in 1 second. I'm going to mute and go ahead and play this.
Mental health advocates in South Carolina say we could be headed for a dire situation as the state prepares to launch its 988 hotline. And the big issue with this is a lack of funding. Launching on July 16th, organizers, mental health advocates in South Carolina say we could be headed for a dire situation as the state prepares to launch its 988 hotline. And the big issue with this is a lack of funding. Launching on July 16th, organizers say dialing 988 will be just like dialing 911, except it will be for those experiencing mental health emergencies like thoughts of self-harm. Fox Carolina's Matt Koufax spoke to the state's only center that will be fielding those calls. It's right here in Greenville. He shares that story.
July 16th is coming whether we like it or not. It was a federal law, and it's happening.
Dennis Gillen says they're hoping that the start of 988 next weekend isn't too fast because of how thin call centers are stretched right now.
Hopefully it's an incremental rise, the people start figuring out that this is where you go.
Gillen is the founder of Half a Sorrow, a Greenville nonprofit dedicated to helping those with mental health issues. He has firsthand experience having lost 2 brothers to suicide.
We're vulnerable, and there's strength in that vulnerability. I would just encourage folks, if you're going through something that you think is bigger than you, share it.
But he and Jennifer Piver, executive director of Mental Health America of Greenville, say there's one big roadblock.
At this point in time, 988 does not have any sustainable funding.
South Carolina's only call center, located at MHA headquarters, was funded by state and federal grants, but that money has run out, and the state has no current plans to contribute.
The federal government left it to the states to figure out how to fund it.
The National Suicide Prevention Lifeline is projecting South Carolina's 988 line will get 107,000 calls its first year. Piver says without proper funding, many of those calls could go out of state.
If someone has done something to end their life, like take pills or something, we want to make sure that emergency response and collaboration with 911 folks is happening locally and that we can get people there as soon as possible.
Legislators we've spoken to say they're aware of the problem and are looking to make funding for 988 a line item in the state's budget.
So let's pay now instead of later. Let's take care of these people up front before they hit the streets.
Remember, if you're feeling any thoughts of depression, self-harm, or suicide, you can always text or call 988 starting July 16th. The hotline goes live at midnight. In Greenville, I'm Matt Koufax, Fox Carolina News.
Piver says the number of projected calls to 988 could actually be much higher because of a law passed here in South Carolina that will put the 988 hotline info on every student ID in the state next year, which is a really good thought. She says many of the callers are school-aged children, and she tells us finding sustainable funding is the top priority right now. We have more information about how you can donate at the website, foxcarolina.com, also inside of our Fox Carolina News.
So, it helped someone I know years ago. She is now, oh, that is awesome. LTL, welcome in. I see the Wilson Dallas here. Frosty After Dark, Single Mom of 4. Thank you guys for being here. Lisa Cooper, always a pleasure seeing you here. And Susan Goins, hello. I thought it was very interesting. The one thing, very interesting is one of my great words, but the one thing that I noticed, just like South Carolina, is that it's based off of a state-by-state level. So I want to encourage every single one of you that is here in the States to go look up your local, when I say local, your actual state's procedures and the funding and how they're benefiting from this. I do have a couple more articles and stuff, how they are going to create the money and the funding to get it operational to help more people. That's important and key. I use this one because this one just came out today. This came out at 4:49 a.m. that they did this little clip. So obviously they've been working on this for a couple days now, which is important. Challenging awaiting the 988. So I'm going to read this one to you guys. The COVID pandemic the pandemic challenged everyone, but from that bleak time, one positive result was that it put a spotlight on mental health, which had been given significant attention for far too long. Now comes nationwide 988 mental health hotline, which will debut July 16th. This will be followed by a January 2023 launch of community centers designed as a one-stop mental health resource covering a wide range of needs. The 988 hotline is a very good idea, period. It does not replace the National Suicide Prevention Hotline, but rather will give callers in need a second option whose digits are much more easily remembered. Dialing either number will direct callers to the same services, but as the 988 line is introduced, operators challenged to avoid or minimize delays, frustrations, and confusions. and not just because of the month gap between the hotline's rollout and the launch of supportive mental health centers. The goal is for mental health callers to dial 988 and not 911, a number ingrained into our consciousness. The 911 hotline receives many calls better answered by mental health experts. How well callers make the distinction, certainly at first, remains to be seen. The coordination of 988 and 911 networks will also be tested. But many reports exist to applaud this new hotline and make it available as soon as possible. Training continues to improve for operators to provide prompt, efficient, quality service on emergency calls locally. The United Way of Pioneer Valley's Call to Talk Center is stepping up to take calls on the new hotline, and the agency experience with the National Suicide Prevention Hotline will serve them well. More people using emergency hotlines to confront mental health issues, a subject long considered taboo, even to the point of discouraging a confidential phone call, has been coming out of the shadows at last. Any assistance the 988 hotline offers will benefit society. Callers should understand that 988 is a behavioral and mental health network, which hopefully will take the stress and workload off of those calls off 911 operators. As with any new system, the first few weeks and months might be the most challenging for efficient operation, but thanks to dedicated agencies and capable operators standing by, it stands to make a huge difference in the well-being and countless individuals who need its help. Great article written here. It's in the description if you want to go back and take a look. I did click, so I haven't clicked on all of these. Hello, Superior Dreams. I want to thank you. I did it earlier. You weren't in here. I want to thank you for putting the 988 little poster thing that I posted on my community wall that I saw you posted yesterday. And I had no clue what it was, so I wanted to research it. And I am so glad that I figured out what it is and that I can share with you. Yes, 988 is way easier than a 1-800 number. So the hotline is 1-800-273-8255. But on July 16th, 2022, you'll be able to dial 988. Way easier to use. And Audrey, it's a pleasure to have you here. And I hope that you take this in to do a video as well. I like listening to your informative lives. Oops. All right. So these little links here, I have this in the description. So if you're looking for information in these articles, these are little links to click. I clicked one of them just to see where it went to. The Lifeline and 988. 988 has been designed as a new 3G code. When people call, text, or chat 988, so I guess you could call, text, or chat it, they will be connected to trained counselors that are a part of the existing National Suicide Prevention Lifeline network. These trained counselors will listen, understand how their problems are affecting them, provide support, and connect them to resources if necessary. The Lifeline number is 1-800-273-8255, will always remain available to people in emotional distress and suicidal crisis, even after 988 is launched nationally. The Lifeline's network of over 200 crisis centers has been in operation since 2005 and has been proven to be effective. It's the counselors at these local crisis centers who answer the contacts who answer the contacts the Lifeline receives every day. Numerous studies have shown that callers feel less suicidal, less depressed, and less overwhelmed, and more helpful after speaking with a Lifeline counselor. Answer the call. These centers are looking to bring on new volunteers and paid employees. You will receive training, so if you are a caring person who wants to help those in crisis, apply today, find your opportunity, and that's at the samhsa.gov/988-jobs. I have that linked in my description. For ways to support your local Lifeline Crisis Center, there's a couple other links here. So I have this is all linked into my description. You can go here and read everything. I did pull up the SAM, which would be the government website here, samhsa.gov. I was checking it out a little bit to see what it is about. And it's loading. So how this affects bigger populated states, we'll go over. I'm going to use New York as an example and show you kind of what they did. And it's a good thing for you to check out your own state. So I live in the state of Illinois, outside of, we call it Chicagoland area. So I live outside of Chicago. So our crisis center is going to have to support way more people than, say, I'll use our neighboring state, Iowa, as an example. So Iowa, there's no big, huge city. So the population is less. But I think that the standards should be set per population. So if you have X amount of population, you should have X amount of workers for these. And there may be guidelines. I don't know how it works yet. I do see about 988 here on the page, and it explains stuff. I linked this in the description. Here's Partner Toolkit. Is intended to facilitate partner efforts to collaborate and align 988 communication planning. Key messages, frequent asked questions, logos, branding, more resources. Urgent realities. There's the Lifeline. There's HHS awards nearly $105 million to states and territories to strengthen crisis call centers service in advance of the July transition to 988. There are some other partner affiliated programs here. Prevention resources. This is a very, very good website by our government. And if you see down here, they do have it in a bunch of different languages to help anybody that is in need. And this is www.samhsa.gov/find-help/988. Thank you, Crystal Langford. So I was doing a little research, seeing what was out there. I came across this one. I wanted to bring this one up, and this one is out of New York. I believe this is the one. Oh, maybe I didn't click on that one. Anyways, the new 988 mental health hotline launches. Communities of color traditionally resist getting help due to stigma. Fear education is needed to help facilitate change. Communities of color need to be educated about the benefits of using the new National Mental Health Crisis Hotline 988, which is set to launch July 16th during National Minority Mental Health Awareness Month, says a former White House representative and 988 spokeswoman. In quotes, historically, when communities of color Sorry, I was getting a phone call. So in quotes, historically, when communities of color are in crisis, we don't call crisis lines, says Tanja Miles, 988 spokeswoman, executive director of Set Free Indeed, and former White House representative with President George W. Bush, Office of Faith-Based and Community Incentives, and its work on substance abuse. We need to tell Black people that the crisis line can be trusted. The operations are there to help and treat you as if you are in a crisis, not as if you're a criminal, she says. I'm going to let you read more of this. There's PTSD, a survivor of substance abuse, PTSD, and some other stuff. This article is very meaningful and something definitely to check out. Give me 1 second here, and I do want to pull up the New York funding stuff that they were talking about. Just give me 1 second to pull up the article here. And and welcome in Crystal Langford, LTL. Hello. So it is said that New York has set $53 million aside to prepare for this new federal law of July 16th to add the 988 number in. Here's a good one by FCC. So here's a fact sheet on the 988 Suicide Prevention Hotline. In August 2019, FCC staff, in consultation with the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Service Administration, the Department of Veteran Affairs, and the North American Numbering Council, released a report recommending the use of 988 as a 3-digit code for National Suicide Prevention Lifeline. In July 2020, the FCC adopted rules designating this new number for the individuals in crisis to connect with suicide prevention mental health crisis counselors. In November 2021, the FCC adopted the rules and expanded access to the National Suicide Prevention Lifeline by establishing the ability to text 988 to directly reach the lifeline to better support at-risk communities in crisis, including youth, individuals with disabilities. The transition will result in a phone service providers and covered text providers directing all 988 calls text to the existing National Suicide Prevention Lifeline by July 16, 2022. So here's just a fact sheet of a bunch of facts. I'll link this in the description of the video here. And hello, Divinity. And great live last night on The Expert, by the way. You need to keep up that hard work. There is an article out there. So if you type in 988 and type in New York, you're going to see the funding. New York has prepared, they set aside $53 million. There was another lump sum where they got some federal money out of it as well. I live in Illinois and I have not looked mine up yet. I highly suggest for you to look yours up and definitely go look and see what the funding is and how they're preparing to set all this up. Obviously, it's going to take some time for it to get up and running and to work out all of the problems with it at the beginning, as I feel that there may be an overload to the 988 number. The biggest thing is it's way easier to remember a 988 number, and it's way faster to dial than having to dial a 10-digit number. I will be, and anybody that's here, I'm going to conclude here with this live. I am going to be live in about maybe 15 minutes with a little exposure to Michael Vaughn, and I am going to show you about monkey mail and how you can receive it. Until the next one, most important thing that anybody can say to anybody is, if you see something, definitely say something.
Straight up, like I said, I would not get on my way. Like I said, I would not get on my way. Coming from the nation, get a foundation, true stuff. Yeah, true stuff. Ain't giving up on our dreams, everything is ahead of us. Certain to repeating is ahead of us. Where you start, it's all where you're at. It's where you end up, when your back's to the match. Where you cripple the flat, get up off your back. Deliver these facts, to see them react. The stadium's packed, they all understand. The motivated attract, the escalated attack. The frustrated hit back, yeah, we move straight. Yeah, we move fast. I wanna change everything. I swear I'll do anything, just to get where I want, just to get won't stop till I won't stop, won't stop, won't stop, won't it's automatic, always getting after it. If you ain't working out, don't understand what's happening. There's not enough time just to be imagining. You gotta take some action towards practicing. I know it's not easy, but you gotta get out there. Make your own meaning, can't afford to have doubts. They'll interrupt him, and I just wanna look out there. The crowd all screaming. I wanna change everything. I swear I'll do anything, just to be where I want, just to be